Hello, everyone. This is part one of June 2nd workshop on breathing pattern disorder.
So, prior to putting the video on, we talked about a bunch of symptomology, what the syndrome is like, and so now what we're going to do is look at just some very practical things that you can do to support breathing. And the first one is the positioning, right? Okay, so pillow below the lower ribs and above the pubic bone. It can also be a folded towel. Now, just something that flattens this curve out so that it's a normal lordosis. You all can talk, by the way. These videos are very casual, so don't feel like you have to behave. A lordosis is important, it's common, but you don't want a hyperlordosis. What happens is that when the vertebrae, this one needs a major chiropractic adjustment. There. Oh, definitely out of scope. I was out of scope. All right. This is normal. Watch what happens when I make it hyper. Everything in the back pinches on itself. Everything in the front, there's a big ligament in there, starts to get overstretched. And the little holes that the nerves come out of change shape and pinch. So you want to make sure that you're supporting a normal lumbar curve and not letting it go into a hyperkyphosis. A little bit of bolstering at the ankles is going to cause the lower limb just to be on more of a lax state because the whole body is involved with breathing. So, and it allows the pelvis to drop down just a little bit. We talked about having the face in the face cradle and how that's not good, right? And then with COVID, they were breathing into pillowcases around here or a mask or that sort of thing. So maybe having them turn their head to the side and generally limiting the time that they're on their stomach, the time they're prone. This segment I want to focus on positioning, but there is one or two approaches that are best done with the person on their tummy. So the first one is to apply some generalized pressure on the strap muscles that run through here. This is the group that people say, I want deep tissue, whatever deep tissue is. It's really the only place where they say, for the most part, they want lots of pressure, is right through here. The strip that starts at the top of the pelvis runs all the way through between the scapula and then to a lesser extent up and into the skull. Those muscles are postural muscles, but they also are part of the breathing and the stabilization of each of the little ribs in there. And they start long and fairly tube shaped, and then they progressively get smaller and smaller and smaller, so there's these little crisscrosses between each vertebrae and each rib. So the body mechanics for that, it's one of the times when instead of having a contact that's 45 degrees, you're going to want to come straight down. So make sure you can see what I'm doing. Can you see what I'm doing better this way? Probably. All right.
And also just reinforcing, like anything, great position, although not for all the massage stuff, but to assess. Because you can kind of feel the springiness and pliability of the ribs. You can compare and contrast one side to the other. As they're breathing, you can place your hands on the low back and the mid back and just feel. If the ribs are moving more than the lower back, that tells you something.
So the So we start superficial and we go deep. The place where your body mechanics are strained is when you're trying to get this strap group in through here. This is the one place where you want your table lower rather than higher. So if you have got a hydraulic based table, this is the time you would bring it down, or you would use a stool.
So, pretty cheap, I believe $29-ish, something like that, on Amazon. You want something broad and flat that's not too high and doesn't have just peg legs, less tippy, right? This was a game changer for me because I needed my table high enough to have my good efficient body mechanics most of the time, but for very specific arenas, whether it be the paraspinals and rip stuff occasionally, but then there was a few times even in sideline to work on like hips and stuff. But this helped a lot, and it's big enough for me to still have a staggered step. And it tucks in, and since my table was higher for my really short clients, it was something for them to be able to use to get up on the table too. But I could just here, nudge it around, and then I don't have to be, it's much more stable for me. I don't have to be standing on a little tiny square. I can still get a staggered stance and come down more.
Now obviously it's too high here.
Right now it would be too high for me,
Yeah.
but you can see how just elevating yourself allows you to, in these very specific scenarios, come more straight down at the midline of the table. And that's where you'll have the most problem, is when you're trying to apply a lot of pressure at the center of the table because you're having to reach forward and deliver pressure. Now,
So how you do that, and we'll have more of a chance to practice this, is that those paraspinals, that group we're after, right where the ribs start to mound up with a little hill, and right along the dorsal fin here, the spinous processes, that's where you're wanting to focus. You're best using a forearm with this. So I'm going to just show you the placement first. So my elbow, you don't massage with your elbow, this part of your arm, but it's going to be a landmark. It's going to hit right where that little hill is on the ribs. And then it's just going to flop over so that I am able to concentrate my pressure right up through that one area. So here, then I need to be high enough so that I can come up on top and then do my glide. You're only going to glide from here to the bottom of the scapula because that's the hill. If you try to glide over it like this, you're going to lose your pressure. So this part you have to get from here and come in, and you'll stop right at the hill. So that's the trick on how you do just that one spot right there. The table has to be lower. You only come to the bottom of the scapula, and then when you are positioned again, you come in around through here.
one quick thing too is just move their arms out of their way.
Oh yeah.
If you're not doing that, this is a common one that just gets lost in this, but sometimes people feel awkward, is if the person's hand and arm is right there. If I'm gonna do this, I have to be right up against the table, and rather than putting my belly right in their hand, move it out of the way. Reposition their arm so you can work here more effectively. Actually, that opens this all up for you better anyway. So as long, I haven't had anybody be uncomfortable laying like this. You may have somebody with a shoulder thing where you have to adapt, but for the most part, getting them set with the arms off to the edge of the table like this helps you so much because you don't have to worry about their arm and you can get closer to the table.
You can also tuck it right under the pillow.
Oh yeah.
I had some people with, shoulder things and it bothered, and I just rolled up one of the little white towels.
Put it right under there. Yeah.
And they really like that a lot.
Yeah.
So
Helpful.
So also, oddly enough, big trick, move their arm.
This is a rolled up towel. I just put it under there. It's actually a
Is it
mop.
a kidney?
All right. The other thing that is best done in this position is the rib springing at the facet joints. Now Luke mentioned that a little bit. So if I were here, it would be, and things should just kind of have a little bit of a soft end feel. And you know where to find yourself, right, Nicole?
Mhm.
Yeah. And what we're trying to do is to just get those ribs to rock just a little bit. One side and then the other comparing. Is one side a little bit more squishy than the other. Be careful in your older clients. They can have the beginnings of bone brittleness, osteopenia, osteoporosis. So the broader the contact, the better. Don't ever push it. Just let your weight take it and then come back up. When I show this demo on a body, I want you to have this underlying structure to be able to visualize. When I'm at the side of the table, it's this way. See with my hands, one on one side, one on the other, on the ribs, not on the transverse process. And I'm comparing one side against the other. It'll look just like part of the massage. But if you find an area that is not pliable, that would be an indication of where we might do an intervention. So an intervention is,
You need a marker.
yeah.
Okay.
An intervention is something that you do with the intent to change something. An assessment is something that you do, is there one in there?
Yes, I got it.
Assessment is something that you do to find out how things are doing. When you do the assessment, I come through here, I do this, and I find it's really stiff on one side, then I want to understand why. So I had open heart surgery. They cut me from here to here, and then the ribs go pring! And guess what happens to the rib at the back? It jams. Now, that has not totally reversed itself. You know, you can't have somebody cut a big hole in your body and then it sprung in a direction that's not necessarily meant to go and have it come back and be the way it was, right? So if you do that to me, you're gonna find I'm stiff back there, but that's about as good as it's gonna get. So just because you find something with your assessment that is maybe not optimal, doesn't mean you're gonna do a, write down intervention, doesn't mean you're gonna do an intervention. No smiling at me ordering Luke around. Cheyenne. An intervention is only done when there is a reasonable and logical expectation that there's a change available. And that's not as often as you think. But it doesn't mean that the general approach isn't going to also help things work as easily as they can. So those are the two methods that will be best done prone. The intervention would be, if you decide that the intervention is appropriate, is our classic intervention of inhibitory pressure plus movement. So what's the movement we're talking about? Breathing, right? Okay, so inhibitory pressure is you squash it. Not to where it's painful. You squash it. So let's just pretend that this was not moving right here. So I'm going to squash that. And then I'm gonna have the person take a big breath. They're gonna move that up against my pressure and then they're gonna blow it out. Or I might have them cough, because that's a big exhale. Inhibitory pressure plus movement.
At peak of inhale, could hold breath a couple seconds, then exhale. So either natural breath, hold breath, cough.
So, put your hands on the sides of your ribs and cough. Did you feel a move? Oh, nice. Inhibitory pressure plus movement.
But also, what does coughing do? It triggers all your exhalation related muscles. It's a force of pushing air out. So, assuming a person's stuck in inhalation, we're usually positioning our pressure in such a way we're moving the rib down towards exhalation, and having them exaggerate and engage muscles that would do the exhale. So that's where the cough, although it's not the most comfortable, is usually the most effective in terms of an actual muscle energy technique for mobilizing the ribs.
And if you are doing an intervention, it may not be always real pleasant. You know, maybe an intervention is indicated, but the person doesn't want to have that degree of involvement with the massage, so then you don't do it. Is your hand flailing around? Was that a, okay. Now, sideline. I've got a better bolster right here.
Oh, thank you. This, with it being thinner.
Oh, okay.
You can see it.
Now, this is what Luke was talking about leaving the bolster under the abdomen,
No.
right where it's at.
Usually there'd be a face cradle, so they would have had to have shifted down as well, okay? So the pillow would be more up at their ribs, creating a pocket for the shoulder joint. You see how you bring in the second pillow now? I had a lot of big, broad shouldered humans. This was very helpful. And my aha moment was, well, and then I tried it for myself and I went, yeah, that's a heck of a lot more comfortable. So even for my sleep, because I was having actually some shoulder issues. So just leaving the pillow there ended up being one of my big aha moments when they turn on their side. And then when they go supine, I take the pillow out.
So, sideline position. Now this is where the work happens, more so than any other place. So, we've got the arm, you know, it can come up this way.
I got it really twisted. Continue, we'll figure it out.
There. Ah, dislocated.
Really stabilized. There we go.
All right. People avoid sideline because they try to use these round, woofy bolsters that don't work.
Round woofy.
There's a round, woofy
Round woofy. A round woofy one?
What you want to
I
do,
want the definition of
and
woofy.
Lucas, yeah. Lucas shown you
So
these
overly
square bolsters.
thin, especially if it's thin but round. One, if it's too thin, it's not good for their ankles or their knees, so it doesn't work well for prone or supine. And especially not side lying. It's never going to be high enough to get their hip into a position where it actually makes them comfortable.
And people roll on it so they
Yeah.
don't feel stable, so then they
So
don't like it.
Even the taller round ones, which I do like for prone and supine, they move all over the place. So a square of foam, when you're out hunting at garage sales, you don't need to buy the whole couch. Maybe you just want to steal a really nice cushion. I think it was Regina that had
Oh, come
this
on.
amazing.
I'm never gonna live that down.
What? It was an amazing couch cushion that worked so good. It was the perfect size. And the foam has been specifically molded off of this old couch cushion.
I still got those couch cushions, I still use those. Now, in the sideline position, we are able to both access the superficial fascia, the wetsuit, and we're able to get to the rib attachment muscles better than any other position. So the superficial fascia, right, so here's this character. Skin tightly bound to an underlying fat layer that then slides on the deep fascia. So you can experience this yourself. Just move your skin back and forth like that. That layer doesn't have muscle in it per se, but it can get dense and stiff. And if it is dense and stiff, it's like wearing Spanx. And or some tight clothing, and we already talked about earlier that that's going to restrict the ability for your ribs to move. So a lot of relief can be achieved by getting this first layer of tissue to slide. One of the best ways to do that is with suction, cupping. So instead of pressing down, we can pull the skin and superficial fascia up and move. You want to get a cup?
Okay.
There should be one in there.
Or do you want the rough ones?
So I am not a fan of gimmicks at all, but the ability to decompress or to pull this only works on the surface layer.
Do you want the plastic ones or the rock one?
I just need one, doesn't
Okay.
matter. So when you're trying to deal with muscle tone, you press down and have them move. When you're dealing with superficial fascia, you lift up and have them move. So, Marie, can I use you for a second? You got a t-shirt on. I know, life's tough. Okay, I'm not gonna, so here is the superficial fascia, got it? All right, if I push it down and have her bend forward, all right, we're getting a stretch or a tension in here. That, if I'm pressing down, that will translate into the muscle layer. If I want just to target this, if I pull it out and have her bend forward, you see how I get much more pull into that area? So same thing over here. If I push down and hold it down, see, I'm starting to get a pulling sensation into that superficial fascia. But if I pull it out and have her do that, it's even better. So that's where.
You see how we
You did a
basically
very good
abridged
job.
myofascial release to breathing? So there is a thing with the autonomic nervous system. When you're stressed, the tone of the superficial fascia does get denser. So it does kind of, it's like you're putting on an armor suit. So there is an effect of the superficial fascia and fascia in general being more limited and denser in response to stress, which of course would respond to breathing. And then if you're wearing a tight wetsuit and trying to breathe, you see how it kind of all perpetuates. Cupping and thinking from a connective tissue standpoint might be a way to work with a client that maybe can't take a lot of pressure. So if you have an older client with osteoporosis and you can't apply the pressure you need, maybe you think more from a connective tissue standpoint. And I remember having I haven't used cupping as much as I would have ideally wanted to, but I remember a really profound experience with a client that had nothing specific, no specific trauma or anything, but just was a dense mess. The skin didn't move, the paraspinals, it was like there was these giant valleys. Everything was just so rigid through here, but was also super hypersensitive to any level of pressure. So it was a difficult body to interface with. Cupping was the game changer. Using it as a up and down the spine, thinking in relation to how the pulling on the connective tissue even is interfacing with the paraspinal muscles. You make the tissue around the muscles more pliable, the muscles are gonna have more room. Then the joint structure is potentially gonna have more room. So this up and down the spine, it's interesting that most cupping, traditional cupping happens there, right? And
Whether they know about it or not. So here's the mechanism. And we're gonna teach you cupping. You all have had that. And there's a lot of different kinds. But you start with everything kind of on a slack. Get the cup to suction. See how it pulls up? Now it's not pulling the muscles, it's pulling the wetsuit. But every time I tension that and I move, I'm increasing the forces that go into the wetsuit. So if a person's on their side like this, and there's lots of connective tissue here, if you look over here at this chart on the wall, lots of white in through there, lots of areas where things can get kind of bound down. So for example, if I were working superficially here, I could put 1 or 2 cups here on the side and then bring their arm up. That would be my intervention. So decompression plus movement. Or I can do compression plus movement. Wouldn't it be great to do both as part of how that's gonna go.
one thing, I know she's gonna do a demo for a sideline, but I wanted to reinforce a bit more for the camera. And if we were trying to work on the posterior segment of the body, but in sideline, so thinking about the facet joints and the paraspinal muscles, quick 2 cents on an angle decision and what part of your body you use. Trying to use your forearm and stuff. If you roll them forward, you can access that, but soft fist goes a long way. And I've got my best leverage. You can't use a lot of lotion with this, but since we're talking about connective tissue, anyway, it's good.
I killed him.
So, that's a good candid moment. I don't know if you guys can see too well, but soft fist, where my knuckles are actually just below the line of the spine, the spinous process. And this is a case where going downhill and letting gravity help me has been very useful. Soft fist position right there, so I can get that line of the knuckle, right up to the spinous process. Stabilize, and then I let my soft fist track down and away from the spine. Even going up along the structures near the scapula, rhomboids and serratus posterior, superior, that is a really good angle. Now again, you can't use much lotion because you need something to hold you back, but I can stabilize and I can pull, I can get really good pressure, sink in. If I need more pressure, they could even lean back into me.
Yeah, that was the thing I was gonna say to you, so go ahead, Luke, and then I would say to them, okay, just lean back against me a little bit.
And take a breath.
And that allows us to get that compression into that area, and it's up against these, where the ribs come into the facet joint in here, so it's moving those ribs back and forth.
I wanted to reinforce that as an option for if somebody also just needs a lot of pressure along this paraspinal line, but you don't have the adjustable table or the step stool. Don't waste your body and energy trying to deliver all that pressure and prone. Turn them on their side and use a soft fist and reposition them that way. You can get a better angle and you can get better leverage, and they can counter pressure against you. So sometimes even for clients that could lay prone, this might be a better option for you just so you can get better pressure delivery. Let me curtail and stop the video there, and we'll move on to the next one. So pause, part 2 coming.